Okay, happy Christmas Eve day, everybody. Welcome to WWP Reacts. I want to get into this this little hearing about Obamacare and the ACA. And this is I saw this and I just had to share it because I was involved when I first got out of the military. I had a contract and it was implementing Obamacare, and probably the worst contract I was ever on. It was really horrible. Um, I won't go into all the details, but it wasn't something I really wanted to do. But I got out of the military and I was on a federal contract with a company. I won't say the name of the company, but they had won a contract to help market, if you will, Obamacare throughout all the southern major cities. And I was involved in that. And I knew right from the start how bad it was by talking to people like this man, but I never talked to him. So let's just hit play. Backstory: this guy lives in the greater DC area. He was involved in, you'll hear him say he was, he had for a long time worked in corporate America, got out of corporate America, became a consultant. So he's an independent employee, right? He employed himself, I guess. He was a contractor, consultant. So he had to then figure out, okay, how do I get health care for my family that was always been provided by the company I worked for? And his little discussion here, I hope you find interesting.
Yes, in front of the Senate. If no harm has ever come to anybody under Obamacare, and it's such a great plan, why are you all not on it? Obamacare is not insurance, but a scheme. Some would say, I would say, a Ponzi scheme to pay for medical bills. My firm recommendation is that if you are on Obamacare now, get out while you can.
Our first witness is Mr. Christopher Briggs. He is the Publications and Public Affairs Counsel at the Independent Institute. He received his Bachelor's of Arts in History and English from Bowdoin College and holds.
It's Bowdoin, by the way, there, Senator Johnson. It's Bowdoin College, one of the most prestigious colleges in Maine. Probably the most prestigious college in Maine. Bowdoin, 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 in Brunswick, Maine. Bowdoin. God, when a senator can't even pronounce the name of one of the most prestigious colleges in this country. Anyways, so this guy wasn't poor, right? He's not a poor guy. But listen to his story. It is really sad.
The Master of Arts in Political Theory from Catholic University. Mr. Briggs.
Chairman Johnson, ranking member of Lumenthal, and members of the U.S. Permanent Subcommittee on Investigations, please allow me to thank you for the opportunity to testify before you today about the harm Obamacare inflicts on the American people. And I just have to say, this is the first time I've had a chance to sit in front of the Senate. If no harm has ever come to anybody under Obamacare, and it's such a great plan, why are you all not on it?
That is probably the greatest line I've heard. You know, we're going to push this on you, the American public, but we're not going to take it. But it's so good.
In November 2015, my wife got the most dreadful call a parent can get. The doctor knew why our youngest daughter, Colette, hadn't been feeling well. Blood work had revealed leukemia. So we raced Colette to Inova Fairfax Hospital, the only one in Northern Virginia that treats pediatric cancer, and got there just in time. Now, thanks to Obamacare, we were already in difficult straits regarding health care. Before the ACA went into effect, the market had offered us a wide variety of relatively inexpensive plans that covered specialist care, even out of state.
So before Obamacare, there were all these plans, and I knew about them because I sold insurance way back in the day. And if you were self-employed, there was all kinds of plans. They were pretty reasonable. Um, Now, of course, you had to pay for yourself, unlike someone who worked in corporation. Part of it gets paid by the company. But these were pretty reasonable plans, and you're going to hear what it cost them and now what it costs them now.
After the ACA, however, all that was left were increasingly costly plans with fewer benefits, including fewer doctors and fewer hospitals. Thanks to the ACA, we were basically restricted to the medical facilities within a short distance of our zip code. The healthcare experts among us will talk about narrow networks. That doesn't even begin to describe the horror. Obamacare made us into medical serfs. We are tied to the land, unable to leave it, even to save a little girl battling cancer, which is why when we tried to take our daughter Colette to Johns Hopkins up the road in Baltimore, we were denied. Under our pre-ACA plan, which didn't geofence sick children from the care that they deserve, she would have been admitted.
And of course, he wants to take his daughter to the best, right? John Hopkins, one of the best in the area for fighting childhood leukemia, where they had to take her, this Northern Virginia Medical Center in Fairfax, Virginia, right where it is. It's a good hospital, but it ain't the best for treating childhood leukemia. And he wanted the best for his daughter, but he couldn't even take her there. On his previous plan, he would have been able to pay it out of network. He would have to pay more money, but he was willing to do that, but he wasn't even allowed to do that.
Now, our predicament was made even more painful by swelling premiums and skyrocketing deductible and maximum out-of-pocket expenses. Pre-ACA, our monthly premiums were about $800 per month, and the maximum back-end expenses was about $3,500, give or take.
So pre-ACA, when he was a consultant, going out into the private market, he was paying about $800 a month. That may sound like a lot, right? Especially if you worked for a company back then, you probably were paying for whole family care, probably about $300 out of pocket. The company paid the rest. But now you got to pay the whole dime, right? So $800, max out of pocket, $3,500. Well, that equates to what I was getting through my company when I was out there working on that contract for ACA. It was about what I was paying, $350 out of pocket and about $3,000 total top end if we needed it. At that point, I didn't have VA medical care yet. I hadn't been approved. But that was in 2013. Okay, so this is 2015, and now hear what he had to pay for less options. Not nearly, he can't even go travel. I mean, anyways, just listen to what he had to pay.
After the ACA went into effect, our monthly premiums, and this is with subsidies, went to nearly $2,000 per month.
$2,000 a month, and he got subsidies. Well, here's the thing, he didn't get subsidies because he made so much money. He didn't qualify for the subsidies, so he had to pay the full rate. So he had to pay that $2,000, where other people, that I'm sure he made a lot of money, right? He was a high level consultant, went to Bowdoin College, he was in the DC area. I mean, he was probably raking in, I would say, $200,000 to $400,000 a year. And so $2,000 a month, okay. So that's with subsidies, but the fact of the matter is he wouldn't qualify for the subsidies. But let's say someone was making in the same area, um, let's say they barely worked. They worked at McDonald's, two of them, because I know examples of this, and they brought home about $48,000 a year. They were walking out of there with no monthly premium, so it was being paid by guys like him and not getting subsidies, and these other people getting subsidies. So zero out of pay. But what they didn't know, and this is what you're going to hear, is the back end amount. Listen to the max out of pocket. Remember I said the max out of pocket pre-ACA was $3,500? Listen.
Annual deductible and maximum out of pocket expenses with subsidies, $20,000 a month. Or
$20,000, he said a month. He meant a year. $20,000 a year for $3,500. Well, there's going to be further questions later on. I'm not going to bore you with all that. And he's going to quantify that to $17,900 and about $819 a month in the exact premium. So his out of pocket expense went from $3,500 total to $17,900. Okay, so what's that? That's a $14,000 difference, right? So he was paying $800 a month, so that would be $9,600 a year pre ACA for premium, and total out of pocket $3,500. So that'd be about $14,000 a year that he'd have to pay. And as he states later on, they didn't really need it those couple of years, um, or the years that he was a consultant, because they didn't have a lot of medical issues until his beautiful young daughter there got leukemia. So now he's paying $24,000 in premium post ACA and a 17.9 total out of pocket, or 18 grand. Let's say 18 grand to make the numbers easy. So he's paying $24,000 a year in premiums and 18 grand total out of pocket, providing health care for this young lady. $42,000 from 14,000. Can you imagine that? Can you afford that? The ACA is the worst thing in healthcare that we have ever done.
Nearly. And thanks to cancer, which my daughter came down with, we hit those maximums many, many times. So think about that. In the 10 years since the Democrats inflicted Obama's health care plan on us, we had to pay for many, many years almost $50,000 annually in insurance payments and medical bills. And that was money we did not have. No middle-class family can endure that kind of expense.
He says he's middle class. I'd say he's probably, well, for the DC area, is middle class, right? Because it's so expensive to live there. For the rest of the country, though, I mean, look, talking to him, I'm not going to have a lot of sympathy. He's definitely upper middle class. Um, Anywhere upper middle class anywhere else in the country, other than New York City, California, Boston. If he's down south here, I mean, I know what I make, and and I know what my neighbors make, and let me tell you, the middle class here is a lot less than what he was making. Anyways, I digress. Let's move on.
The upshot of our decade of affordable health care under Obamacare, our savings are gone. And we have virtually nothing left to retire on. And to handle the remaining debt, we are beginning the process of taking out a home equity loan. And this is the subsidized affordability that the Democrats today insist Congress perpetuate. Now, in those dark early days of cancer, when my daughter was first diagnosed, things got much worse than expensive.
See, and this is what the Democrats want to keep perpetuating now, right? This is the whole argument over the government shutdown that happened a couple of months ago and may happen again. No one talks about that yet, but I believe by the end of the year they have to come with a budget. But anyways, because we're in a continuing resolution, what's called a clean CR. This The Dems want to continue the subsidies. They want to continue the status quo. And guys like him and most Americans again that work and make any money at all are getting fucked over.
2018, Obamacare literally offered us no plan in our zip code for any amount of money that we could buy that covered Colette's treatment at the one pediatric cancer ward in Northern Virginia, in Nova Fairfax. So under Obamacare in 2018, our daughter was effectively without coverage for cancer, not a common cold or a broken bone, but cancer. What kind of health care?
And that is because these health insurance companies were losing money. Even with these subsidies, they couldn't afford to stay in place. So places like where he's at, they said, okay, what can we get rid of that's not going to really impact a lot of people? Well, childhood cancer, because it doesn't affect a lot of people, and we're going to get rid of it in this area. So he had no no medical care for his daughter as far as it came to leukemia. Crazy.
Plan did the Democrats inflict on us that it can't handle childhood cancer? We went through another terrifying event in 2020. Now, with COVID sweeping the country in mid-March, the plan we had that year announced that in 2 weeks, it would no longer cover my daughter's clinic, where she received a lot of her chemotherapy. So once again, thanks to the ACA, we were left without coverage for our daughter recovering from cancer. Now, in both cases, we had to appeal to the author of our problems, to the government, to all of you. And fortunately, I was able to persuade, threaten the Senator's Warner staff to bully, in both cases, an insurance giant back into the marketplace.
And I am surprised he got Senator Warner because Senator Warner, what? He's a big lefty, I think, right? And he I'm surprised, but thank God that they were able to get this massive insurance company come back into the marketplace, in the ACA marketplace, so that he could, even it costs him 50 grand a year. What a, unbelievable, to provide chemotherapy and other treatments for his daughter who had leukemia. Unbelievable. Can you imagine being in his shoes? I mean, I cannot imagine being in his shoes. It's just unfathomable. I don't get it. I really don't get it. It's a shame. It's a scandal. Well, anyways, tell me what you think. If you'd like to see this kind of comment and get some commentary on what's out there, I like to do it. It's kind of fun. I like talking about current events. And yeah, like, subscribe, share my channel with your friends, and shoot me some comments because I'd love to hear your thoughts and I'll answer your comments for sure. And if there's something else you want to see or hear me talk about, I'd be glad to do it. My name's Bill, WWP Reacts. Have a fantastic Christmas Eve day, and we'll talk to you soon.